Hey, future clinicians. So today we are talking about cystic fibrosis. This is our short note today, so watch the video till the end. You can refresh what you have studied and learn something new from this. We are going to cover every important point. Do not skip anything. All right, let's begin slowly and clearly. First, what exactly is cystic fibrosis? Cystic fibrosis is a genetic disorder. Do you know what that means? It means the problem is present from birth because of a gene mutation. And this disease does not affect just one organ. It affects multiple organs in the body, especially the lungs, the pancreas, the liver, the intestine, and even the reproductive system. Now here's the core idea. Very important. The body produces thick, sticky mucus. Instead of thin, slippery secretions, the mucus becomes dense and hard to clear. And this single problem explains almost everything in this disease. Now, let's move to the clinical features. Try to imagine this. If thick mucus blocks the lungs, what happens? Yes, patients develop pulmonary disease. They get recurrent lung infections again and again. They have a persistent cough and they produce thick, viscous sputum. This is the most important feature. If you remember only one thing, remember the lungs. Now think about the pancreas. If mucus blocks pancreatic ducts, enzymes cannot reach the intestine. So what happens? Malabsorption. And because of that, patients lose weight, they develop nutritional deficiencies. Now let me ask you, why is nutrition so important here? Because these patients already have chronic disease, and poor nutrition makes everything worse. Now do not forget the other complications. These are very important for exams. There can be hepatobiliary disease, there can be osteoporosis, there can be cystic fibrosis related diabetes, and something called distal intestinal obstruction syndrome. So you see, this is truly a multi-system disease. Now let's understand the aims of treatment. Before jumping into drugs, always ask yourself, what are we trying to achieve? We want to prevent lung infections, manage infections when they occur, remove thick mucus, maintain lung function, ensure good nutrition, prevent intestinal obstruction, and maintain proper hydration. Now listen carefully. This is a high-yield concept. Lung function is the key predictor of life expectancy. So whatever we do, we are trying to protect the lungs. Now let's talk about non-drug management. This is very important, especially for exams. Patients should be managed by specialist physiotherapists. They help with airway clearance techniques, nebulizer use, exercise advice, musculoskeletal care, even issues like urinary incontinence. Now think, if mucus is thick, it must be removed regularly. So airway clearance techniques are essential, and patients must practice them regularly. And what about exercise? Do you think exercise helps? Yes, definitely. Regular exercise improves lung function, improves overall fitness, so always advise patients to stay active. Now, let's move to drug treatment overview. Treatment mainly focuses on preventing infection, maintaining lung function. Patients should be reviewed regularly, at least every 3 months in adults, and even more frequently after diagnosis. Now we come to a very important topic, mucolytics. These drugs help break down that thick mucus. First line, we use Dornase alpha. If response is not enough, we can combine Dornase alpha with hypertonic saline or use hypertonic saline alone. Another option is mannitol inhalation, especially if Dornase is not suitable or lung function declines rapidly. And one important point, Lumacaftor plus ivacaftor is not recommended here in this context. Now let's talk about pulmonary infections. This is a big exam area, so focus carefully. First, Staphylococcus aureus. If the patient is stable, we use oral anti-staphylococcal antibiotics. If the patient is unwell, we go for oral or IV broad-spectrum antibiotics. For chronic infection, long-term antibiotics may be needed. If it is MRSA, always seek specialist advice, and do not routinely suppress MRSA if the patient is stable. Next, very important organism, Pseudomonas aeruginosa. If it is a new infection, we start eradication therapy using oral or IV antibiotics plus inhaled antibiotics. If eradication fails, we move to long-term inhaled antibiotics. First line is cholistomethate sodium. If the condition worsens, we can use aztreonam nebulized tobramycin. Next, Burkholderia cepacia. This requires IV combination antibiotics, and always specialist advice is needed. No routine suppression if stable. For Haemophilus influenzae, oral antibiotics if mild, IV if severe. For non-tuberculous mycobacteria, do you treat all patients? No, only treat if the patient is unwell, and this is a specialist decision. For Aspergillus fumigatus, use antifungals only if lung function is declining. And if the infection is unknown, use broad-spectrum antibiotics. Now, let's move to immunomodulatory therapy. Long-term azithromycin is used. Do you know why? Not just for bacteria, it reduces inflammation and exacerbations. If there is no improvement, stop azithromycin and consider corticosteroids. Now, very important, nutrition and pancreatic support. A dietitian must be involved because nutrition is critical in these patients. We give pancreatic enzyme replacement, pancreatin, and the dose is adjusted based on symptoms. If malabsorption continues, we add acid suppression therapy like PPIs or H2 blockers. Sometimes appetite stimulants are used, but only for short-term, up to 3 months. Now let's discuss distal intestinal obstruction syndrome. Treatment includes hydration, oral or IV. First line is meglumine plus sodium aminotrizoate. Second line, polyethylene glycol, also called macrogol. If everything fails, surgery is the last option. And remember, this must be managed in a specialist center. Now, about liver disease. If liver function is abnormal, we use ursodeoxycholic acid. Next, bone health. We must monitor bone mineral density because there's a risk of osteoporosis. And finally, cystic fibrosis-related diabetes. Regular monitoring is essential. Now let's finish with a simple summary. Cystic fibrosis is a genetic disease, a multi-organ condition mainly affecting the lungs and pancreas. Management focuses on lung function, infection control, nutrition, and always remember this golden line. Good lung function means better survival. If this helped you understand cystic fibrosis better, make sure to like, share, and subscribe for more simple medical lessons. And in the next video, we will cover cough and congestion in a clear and easy way. So don't miss it. See you in the next class.